Hey everyone, it's Dr. Tam from Absolute Integrative Physical Medicine.
And Dr. Bird.
And today we want to share with you why catching problems early is so important. Dr. Bird, can you tell us a little bit more about what happens? What have you seen when people wait a little bit too long? When is it too long? When is the right time to come in? And gosh, why would people want to come in?
Yeah, of course.
Okay, let's talk about that.
The main thing is when it comes to degeneration in our spine, over time, due to gravity, due to certain traumas, due to postural positions, work as well, we get degeneration and compression. And it's always easier to treat it sooner than it is to treat it later. We've seen patients over the course of 5 years, if left untreated, come back, we take a new set of x-rays, and we can see the degeneration go from moderate to severe.
I know exactly who you're talking about too.
The main thing is if we can catch it earlier on, you're going to have more successful treatments and more successful outcomes. If we wait too long and there's too much severe compression at point, you're looking at surgeries and medication, which I'm sure most of us don't want to go through.
No one wants to go through that. We hear a lot about patients where they say, it's not that bad, right? I used to do spinal screenings. You're out at the home shows and you get people to, hey, let's check your posture. Let's check to see how you're doing. And people walk by and says, oh, I'm not that bad yet.
Yeah.
Right?
Yet
Is the word. You know what I hear, or what I actually see in general, when people say they're not that bad yet, that tells me they're a little stubborn.
Yeah.
But they've also been bad for a while. No, they're bad. They are just afraid.
It doesn't happen overnight.
The fear. How often do we see people that says, I know it's bad, but I don't want to know how bad it is? What would you say to those patients?
I would say, I don't want you to look back 5 years down the road and say, what could have happened if I were to treat this earlier? And the negative effects it could have on your life, your family, relationships. If we treat this earlier, it can really influence that and make a lot of positive changes.
What have you heard how a bat's pain, you look at, this is a normal bone. And the reason why people have pain is anywhere anyone has pain, it's affected a nerve. Would you agree?
I would agree.
Because somehow, the reason why you felt that pain, wherever it is in your body, there's a signal, there's a nerve that's impulsing back to your brain, telling you that there's a problem. Well, over time, tell us about what's happening. This bone looks pretty good.
Yep.
This is not too bad, but what in the world's happening over here?
Phase 3 and phase 4, is the disc space is completely lost. And the disc has dried out, and the bones are now starting to grind against each other. And what happens is we form osteophytes, bone spurs, and we also lose the tunnel in the back where the nerves come out. So if you look at the model of a bone, you have this tunnel back here, the IVF, that's where the nerves come out. And over time, due to compression, trauma, degeneration,
now, just
that tunnel is small.
This is the normal size, how big that tunnel actually is.
Massive.
Right? You compare that. Who do you think is going to be in more pain?
I would assume this person is going to be in more pain. Most definitely. And when it gets to this point, it's a lot tougher to treat. It doesn't mean it's untreatable, but it would have been easier to treat it earlier on in the degeneration process.
Now, when someone hurts their back, most of the time, where are they by the time they come in? Like, they know it's bad enough to come in. Where do we see most people?
Towards phase 3 and 4.
We see them towards phase 3 and 4. I would love to see people in phase 1 or 2.
Yep.
But it just doesn't happen. I don't know if it's just human nature to try to fix themselves. You know who's worse? Guys.
Oh, we're stubborn. We're stubborn. We don't go get help unless we absolutely need it.
Guys going to the dentist, they've got a cavity exploding out of the side of their mouth before they go. Same thing when they come to us, they can't do anything anymore. Or they can do some things, but it's prevented and it's hurt a lot of not only people around them, but themselves as well. Their self-esteem, their confidence. What are some things that you hear people go through by the time they come to us? What are some things that you hear that gets affected?
Plenty of things. First of all, I can't work anymore. So people have to quit their jobs or stop working.
Well, we had a gentleman today.
He had to stop working. We have relationship issues. We can't hang out with the spouse. Can't go on walks. Can't go on hikes. Affects raising children. If you got children, can't hang out with the children. It's very sad when you got grandkids growing up, your kids growing up, and you can't be out there to play with them, have a good time. You got to sit on the bench while they're all out having fun.
Or they can't even go.
Exactly.
They cancel trips. People can't go on cruises.
Can't go on hikes, walks.
A cruise is supposed to be a leisure thing. But they're worried about not able to walk around and get around the cruise boat.
And what's really sad is these patients, they work so hard for their retirement, and they get into the retirement phase and they can't enjoy it, which is really
How
important.
many of you out there worked all your life hoping that you can get a phenomenal retirement life,
Yep.
but because of your body, you're not able to retire the way you want to?
Exactly.
That's probably one of the most sought out or set things in our consultations.
Yep.
Also, another big one,
What's that?
independence.
Oh, big time. We got a lot of patients living on their own, and they're the only ones looking after themselves. And if you can't look after yourself, it's tough. It's tough. You have to look for outside sources, get family to come in and help, and
Right.
we feel guilty if we have to do that. We don't want to have to go
Right.
down that road.
We had a patient today that one of their family members has to move in with them from another state
Yep.
because they're no longer able to take care of themselves.
Exactly.
That's not something you want, I'm sure.
Of course.
So if you are starting to feel something, whether it's in the back, by the time it starts going into your buttocks and legs, it's starting to get worse. So it's always better to catch it earlier.
Preventative care. If you can prevent that
later.
for future, it's going to save you money down the road too. You're not going to have to spend as much money to treat it if you treat it earlier on.
And some of our patients learn it the hard way.
Yep.
They wait way too long and they need more procedures done, different procedures, from the decompression to regenerative, trigger point therapy. The longer you wait, the more you might need in the long run.
And I like to stress that I would love for more patients to come in for a second opinion before going down surgeries, medications, cortisone injection shots, because we all know a cortisone injection shot, it's treating the symptoms, but it's not treating the
It's
cause.
actually tearing down.
It's worsening the problem. It's
bone and
accelerating
joints.
the degeneration process. And a lot of times, the second opinion, they come to us after they go see a lot of different medical doctors, different specialists, and we have to undo a lot of that work that's increasing that degeneration.
We had a patient that had surgery. And it was great for the first couple of years in L4, L5, S1. But what happened is that over time, if you think about one bone stacked on top of another, and they went in and shaved off part of the bone spurs, right, part of the disc. But what happens is, how's the integrity of that bone now?
It is gone. And the joints above and below it are now more susceptible for increased degeneration,
Right.
adjacent segment disease.
So that specific patient felt good for 2 years. And by year 3, it started getting worse. She came to us right around year 4 and 5, and it's bad. We took a look at her x-rays, and the L4, L5 area is just almost like it's crumbling.
Yep.
Because you actually took out the foundation. Imagine a 30-story buildings, and the bottom 2, you took out part of the foundation.
You don't have a
I
solid
mean, that
foundation.
thing's about to collapse. Let's talk about one other thing. What happens when patients actually come in? What actually happens?
The whole process. So we sit them down. We take a consult. We take all their history, all their information. We got to make sure that we do a deep dive, not just only on where the pain is, but other sources of pain, what medications they're on, have they gone through different surgeries, their history, occupational history. So many pieces of information that are critical. And that's just the history aspect. Then we go in, we do a thorough examination. We check for range of motion. We check for trigger points. We check for posture. We also take them back and we look at x-rays as well, because seeing everything on the outside is one thing, but when you actually can visualize things on the inside of the body and the bones, you get a much better picture, and we can really help to treat that as well.
Oh, you may not get treatment the first time. That's because anyone who's ever had problems with degeneration or have had injuries, we got to see what's actually happening on the inside. But there's so many people that actually want treatment the first day. And what we have to tell them is, you know what? Let's find out what's going on first.
Yep.
And then they go home. We actually do a team meeting. So for those who don't know, we actually sit down, me, Dr. Byrne, our other nurse practitioners, providers, case managers, all sit down in one of the consultation rooms, and we actually put your x-rays up on the big screen and we go through it together. That's what makes our office an integrative office, where we work together, integrative, versus a multidisciplinary office where everyone's on their own.
They're not working together.
They're not working together. And depending on what treatments patients need. Why do we have these bands here?
Exercise.
Exercise.
Keep in motion, keep them moving. It's important to prolonged bed rest, prolonged sitting is the worst thing for us. But a lot of us, we're in so much pain that we can't even exercise to begin with. So we have to treat the pain and decrease that pain so we can get back to exercising, get back to the motion, get that blood flow going, strengthen up those muscles. But you got to have a solid foundation first.
You got to have it,
If you're-
especially if someone had a weak foundation to begin with.
Yep.
You got to build that back up.
You don't want to be exercising when your spine's all out of whack and the foundation is not solid.
Hope you learned a lot today. Until next time, Dr. Byrne and Dr. Tam here. Take care, everyone.
Have a great night.